Good afternoon. Good afternoon. Hey, I want you guys to know the state of Florida is doing an amazing job with this. Have you looked at the data? I will bring up the data. I was checking out California. I was comparing them. Okay, so this is the state of Florida. So this is the number of deaths per day. All right, so initially, if you would have looked at this way back here, it went way up here and around. So as our deaths have come down, look at how much lower it is than what projected. This is the projection. This was projected to go up and around like that. We are flattening the curve. Good job, everybody. It takes the whole state. It takes all of us doing this to flatten that curve. Okay, now it says in 14 days we're projected to peak. I think they're lying. Actually, I think we peaked already, and I'll show you why. So here, resource. So this is the number of hospital beds we have available, and this is the number they project we're going to need. Look, it's huge. We are way under the projection and what we're going to need. Way, 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 way under. Here is how many ICU beds they think we're going to need. And here's max projection right there. It's still under the curve. Still under the curve. Number of ventilators you're going to need, it's still under the curve. So we're doing really well with that. Let me see, did I keep up? I want to show you one more. So this is Florida Department of Health. If you guys are listening to information, make sure you're listening to it from reliable sources. From the Florida Department of Health, or the WHO is what I showed you up there, which is healthdata.org. That's the World Health Organization. This is the Florida Department of Health dashboard. It tells you a lot of things. It tells you that in skilled nursing facilities in Lake County, there are 2 patients that are positive. Marion County, there's 1, and 2 in Sumter County. We currently do not have any that we suspect, nor that we are testing at the moment. So we have none, okay? And we want to keep it that way. So everybody wash your hands, and how do we keep it that way?
Wash your hands.
Wash your hands. Don't touch your face. Don't make contact with others. Because if you make contact with your sister who made contact, with her brother who made contact, with his kids who made contact, with their 3 kids, then you have everything that all of that chain already got. All that comes to you. It comes all the way through that chain. We want to keep our patients safe. Our patients safe. You and I get it. 86% of people who get it recover. Well, actually, the death rate is a lot lower than that. There's 354 deaths that we've had out of 15,883 positives. So if you look, here is the number of cases per day. It peaked right here, and look, it looks like we're kind of flattening out a little bit there, doesn't it? Right through here. So I think, according to the epidemiologists, it might be the warm weather that's doing that. That's really, if you look at all the warmer states, Arizona, California, Nevada, their rates are coming down. Their rates are coming down. But over 80 degrees, a lot of fresh air. That's a good thing. Also, I think personally, nobody's told me this, but but the states with the higher elderly population seems to have better death rates also. Maybe we're more used to, in other words, the death rates aren't as high. Maybe we're more used to sicker patients, or more used to dealing with more respiratory issues with elderly patients. I don't know. Anyway.
That drop in there,
yeah.
That little drop that right there,
Uh-huh.
is that 2 weeks in between those two? Because maybe someone was asymptomatic and then finally...
This is every day. So every day the number of positives. Each little bar represents 1 day.
Okay.
Yep. So that's each and every day. That's a good question. All right, so we are looking at, there we go. Miss Joyce, my assistant, my able-bodied assistant, where did she go? Where did she go? All right, so Joyce is going to be our assistant. We're going to go by the guidelines here on how to put... On how, oh, don't laugh.
Already laughing.
We're already laughing, that's right. She's going to go how to put on and take off your personal protective equipment. Because we might need this, we never know. If we have a suspected case, we're going to put them on droplet precautions, and we're going to have all this equipment, which is in all the boxes that's sitting in my office, sitting outside the door. And so this, you're going to need to know how to don and doff, how to put on and how to take off the personal protective equipment the right way. If you contaminate yourself, you're going to contaminate the next room over that is not on droplet precaution. That's a problem. That's a bad thing. And according to, let's see, what was that statistic, CDC? I think 70% of people who put on and take off personal protective equipment contaminate themselves in the process. 70%. So 70% don't do it correctly, so we thought, well, you know what, we might as well practice. All right, so Joyce, so everybody read. So what is Joyce supposed to do first?
Wash hands.
Remove all her personal jewelry.
Turn on the music.
Yeah, turn on the music. All right, so we need some slinky music here while she... No, that's for taking it off, not putting it on.
Take it off.
At the last jacket.
You had the bunny right.
Take it off, Joyce.
What's that?
Bunny was following her.
Bunny's
Take it
laughing.
off.
Whatever from laughter.
And this is sterile stuff because it's a surgical thing, but
You gotta take her jewelry
very
off.
sterile.
Okay, so first step, remove any personal items and jewelry and put in secure location.
Okay, secure, here you go. Take that.
No, she needs those. She's got to see.
Yeah, my glasses are
Essential.
That's essential.
Number 2, sanitize hands.
We're sanitizing with lotion because I didn't.
Okay, so number 3, put on contact gown outside of the room. Open end, faces the back, and tie the ties.
Y'all need to pay attention over here. This is important.
We're going to have them demonstrate it too.
Ah. So, just know that this is an extra large.
Oh my goodness.
No, this
And it has a tag on
There you go.
it. Okay. And then I have to tie all the ties. This is Velcroed actually on this.
And if you need a buddy,
I know that goes.
the buddy can help.
As long as they have their hand sanitizer.
I actually,
Here, oh, hand sanitizer. All right, that's right.
You go with the motion.
like I said, no laughter, because I don't know where the other ties at. I've lost it.
There we go, okay. So
Okay,
she's
good.
putting on her gown.
She looks so tiny in that now.
She does, she does. Actually, I have a picture of Joyce in one of these get-ups.
Real deal.
Can she
But it was good. The outcome was good.
Did you bring gloves?
No, I didn't. I can't put any gloves on. Okay. Right out of her pocket.
Thank you, ma'am. I'm sure they're nice and clean in her pocket. By the way, pockets are not clean.
Not at all.
CDC even says that, pockets are not clean. But,
Okay, and then the gloves go on and they go.
so the gloves go on over the cuffs of the gown. Did you bring your in?
It's,
Oh, you're gonna open that one?
yeah. I-
Save it. Here,
We'll
let's see.
just pretend like we have one. Well, I have a mask on right here.
Okay. Oh, there, you have a mask on. Okay, so put on face mask. You're not gonna put this one on, but we're gonna put this one on for right now, because we don't wanna waste our N95s. you go. And now you're not supposed to touch the outside of the face mask. Put on face shield or goggles. There you go.
This is a fun one.
Now, our face shields, and according to CDC, we do reuse our face shields, so after you have one assigned to you, that'll be yours forever. So you take it off on a wipe down the surface. There she is. And pretend, there you go, sanitize your gloves. And then you're going to enter your room, do not touch face or readjust mask or face shield inside the room.
Oh, so you sanitize the gloves too?
You sanitize the gloves too before you walk in the room. All right, so next, we're going to take it off. Now we need music. Mike?
Take it off, Joyce.
Okay.
Debbie,
Yes,
are we going to reuse them?
we are.
Like sterilize them, so we're not throwing the gallons,
Right,
right?
right, that's correct. Yes, yes, we're gonna put them in the auto. Okay, so you're gonna dispose them. We'll have another container in there for putting the gown in, and then of course the garbage can for the gloves. So now she crosses her arms, grips down, gown on shoulders, pull and break gown in controlled fashion. All right, roll the gown towards the, I guess, you know what, they forgot a step here. We were supposed to untie it. They didn't put a step in the guy. We're gonna have to let them know that.
Typically, they're not touched. Typically, throw them away.
She's supposed to sanitize her gloves.
I did that.
Oh, no, after she comes out of the room.
Okay. Oh, well, okay. All right, so roll the gown towards your hands. And then you're gonna put the gown in, we're gonna have an empty, a laundry barrel right here. All right. I'm pretending it's the laundry barrel, but we're gonna use this for somebody else, so I'm not gonna put it in it. We're gonna pretend again. Okay, and then remove the gloves. I know, but we're not,
We're keeping the gown.
we're keeping the gown, reusing them.
So don't throw the gowns away.
Right, don't throw the gowns away.
And don't pull it off either because the tie is.
You gotta untie it first.
Yeah, you gotta untie it first.
Yeah, I know particularly when something has a Velcro, it's tough, so.
Yes, okay, so throw those gloves away, we'll throw them away. Then we're supposed to put on new gloves. We need
New gloves,
new gloves, sanitized gloves.
gloves sanitized.
Don't touch the face. Remove face shield by the strap over your head without touching the skin. And by the way, we're not going to require you guys to remember this. These signs will be at the point on the wall, okay? Because nobody's going to remember this. And so, it doesn't tell you. So you're supposed to put that down on a,
You're supposed to have some sort of surface.
a wipe. So put a wipe out on the table. Put this down on the wipe so you can wipe it. Then you sanitize the gloves again.
Okay, this is sterile, so I'm gonna put this here,
Well,
because this is a
clean.
sterile package.
Clean pack. There you go. Sanitize gloves. Now you're supposed to remove the mask with the straps.
And we are going to only remove this one through here.
There you go. And then remove gloves again. And immediately wash your hands.
And so you may wash hands with soap and water. So-
Yes, ma'am.
Because I got lotion.
Wouldn't we wanna put shoe covers on and like something over the head because they say it stays in your hair too.
Yeah, that's what I was just gonna ask.
Actually, so the CDC says that the least, if you don't have the PPE, at least wear the mask and the face cover or the eye shields, but that there's a very low possibility on your clothes.
And they don't recommend, yeah, that if you have.
And they don't recommend shoe covers.
If there's a shortage on gowns, then they recommend that you can use cloth gowns. If you don't have one, actually the face gear is the most important.
The face gear is the most important. Okay, who wants to try this? We need a guinea pig up here now.
Just take a shower.
We need a model.
Head shower.
No! Ed, somebody.
All right, Gracie.
Maybe somebody. Okay, let me get the gown on.
Okay, you guys help her now.
What is she supposed to do? Sanitize her hands.
Wait,
Sanitize gloves, sorry.
wait, what's number one step?
Remove the personal items.
All right. Now what are we gonna do? Let's see, where's Gail, where's your hand?
Okay. Down to the basics. There is a picture of one lady who's
I gave a lot to her. Okay.
Okay, then gloves.
What else? What's the next? Wait, what? No.
Wash your hands.
What's the next step? Put the gown on is the next step.
Sanitize hands.
You're good. You're good. Oh, Joyce ripped the tags off.
We got the point.
And just put the Velcro on.
Okay, thank goodness. All right, put on gloves. Put on gloves.
So I'm supposed to sanitize your hands?
Not yet. She did before she put on the gown. Remember, I sprayed her a lot.
I smell it.
There you go. Good Grace. Okay. It says put on mask and fit mask to nose. So at this point, you do touch the outside of the mask. So put on mask and fit mask to nose. Make sure it's there. You go. Now put on face shield or goggles. There we go. I have to get a picture of Grace like this.
Oh, yeah.
She's looking snazzy, huh? Okay, sanitized gloves.
Looks like she's going to the ICU.
And she's ready. Ta-da!
Hey, Grace.
All right, take it off.
All right, I'm taking all off. Sanitized gloves. All right, cross arms, grip gown on shoulders.
You gotta hug yourself at the top.
There you go. Roll the gown towards the hands and remove the gown. And then as you bring it off, take off the gloves too. All right, put that there. Good. What's she supposed to do next?
Sanitize hands.
No, gloves off. And then I'm going to have you put them right back on. All right. I know. It's okay. I'll give her another pair of gloves. Yeah, it's okay. Sanitize. Okay. Yep.
Well, those probably aren't the right size either, Gracie. I'm
No, I'm trying to find it.
Just grab it.
Small. My hand fell.
All right, remove face shield by the strap only. Don't touch the outside of the face shield, and lay it down so we can then wipe it with a disinfectant wipe so we can sanitize gloves. Okay. Now pinch bottom strap and pull the mask over your head. Take your mask off with only touching the straps. Good. Good.
Sanitize gloves again.
Remove gloves and wash hands. That's it. All right. All right.
So in reality, we're using that N95.
So we ordered N95s, we got in KN95s. Okay, so
What is that?
a KN95 is what they use in China and other places. It's approved, it's FDA approved. It's not as beefy as an N95, but they say it's just as effective. So I do have 3 boxes in my office. They're there and ready for the using if we happen to need them. We'll use the face masks over the top of them as well. We do have a number of face masks and gowns, etc. We have all the accoutrements that we might need for any time we have somebody that's on droplet precautions. Yes, ma'am.
We all had one client that was spitting on the floor all the time. You got some
Yes.
that can give us shoe protectors?
Yes. And I do have 2 boxes of shoe protectors in my office. Yeah, no, we have them ready and available in case we need them. And we are hoarding them. We're going to keep them until we need them. We're not giving them away.
Debbie, what
Yes.
if you get fluids on your gown, like blood, urine, whatever? You're not going to throw those ones out?
We are going to throw those out.
Okay.
Yes, if you get any kind of body fluids on the gown, except unless it's one of our reusable gowns. We have ordered some cloth gowns that are reusable, and those, of course, if anytime you're in a room and you think you're going to get something on your body, on your clothes, then use one of those gowns, and then you put that in the laundry. Okay. Now, if it's blood, that's different. Blood, if it's visible blood, it's got to go in the red bag and biohazard. All right. Okay. Questions?
You basically said that you're gonna have everybody tested twice. Does that really work when it takes a couple of weeks to show up?
Well, they're thinking after exposure that you start building antibodies pretty soon, pretty quickly. So even if they have no symptoms, then they're still going to be, then they're going to show up as a positive. Because people with no symptoms have been showing up as positive. Right now, up until this point, I understand that as of today, they're going to have enough tests. They haven't had enough tests, and they've only been testing people that have been symptomatic. If they happen to come up symptomatic here without a reason, because if they already have a respiratory problem here, then we will, if they already had a respiratory problem in the hospital has already tested them. But if they come here and they all of a sudden come up with a respiratory issue, then we've been testing them. We have access to the UF developed their own test. It's a 45-minute rapid test, and we have access to it. So we can get results within 45 minutes. Yes, ma'am?
What do you recommend to clean the face, the goggles?
Just a disinfectant wipe.
Because some of them are greasy, like the ones we use to clean in the gym. Some of them are kind of greasy. The spray,
Uh-huh.
it'll be like
Oh, it's because they leave a residue. I don't think they're
Yeah.
greasy, but I think they leave a residue. I think actually, and I'll pull up, the Emory University has advice for that, and we'll see what that is. I think they suggest to use the bleach wipe or the cleaning wipe, and then to use like an alcohol swab. But I'll look and see. It's good to be able to see out of them afterwards, I know. Yes, ma'am.
Some of my colleagues in New York are buying like the little plastic that you use when you're dyeing your hair
Uh-huh.
to just cover their hair.
Ah.
A lot of the therapists are using it too.
Oh,
shower cap.
Yeah, like shower.
like a shower cap.
And it's easy to just sanitize.
Okay.
No.
All right. I haven't, I've watched a lot of videos and we're on the phone, twice a week now with Department of Health and CDC and the Surgeon General. And so they haven't mentioned anything, and that hasn't been a recommendation as of yet. But if they do make it a recommendation, we'll do it. And if you feel more comfortable doing it, then certainly you can. Yes, Nicole?
Yes, what's the difference between the ACE and the DICE?
A what?
That's on here.
Oh, yeah, it does say that.
You got an ACE mask and you got a DICE.
That's Spanish for decent.
At the top.
Really, yeah.
See where it says ACE and DICE? See if I have a little mask?
ACE.
It says off and it says ACE.
Yeah, I see that. I don't know what it means.
Totally different kind of mask.
Are they different types of
Totally,
masks?
yeah. Totally
Okay.
different types.
I don't know. I'll look it up. I'll read the literature. This is from Emory University. You can see this for yourself. Google Emory University PPE. Now, if you Google how to don and doff personal protective equipment, there's a lot of different recommendations for the different ways you can put it on and take it off. There's a whole bunch of different schools of thought. This is actually happens to be almost what the CDC recommends. It's what Florida Healthcare Association recommends, American Healthcare Association recommends, and the Florida Hospital Association is doing. CDC is a little bit different. There's one step that's different, but I didn't want to confuse you.
There are lots of different masks, so,
There are a lot of different
because
masks.
of the shortage of masks out there, they basically say to use what you have and use the face shield.
So they're recommending to the public to use cloth masks because they want the public not to buy up all the masks that the healthcare workers need. Us here, the only permissible masks are these that have the autoclave material because it blocks out 99% of the particulates. The face shields that you have, the surgical masks that you have are not as effective, but they are okay to use. And the N95 or the KN95. So that's what we are allowed to use in the facility. Questions?
Okay, so I just looked it up. DICE is for anti-dust pollen mouth mask for allergy and flu and pollen-type symptoms. ACE is a more aggressive mask, including the N95, KN95, and such. You guys get that?
There you go. Thank you, Adam. Thank you. All right. Oh, yes, okay, so, we had a situation just recently the other night where I know it was rumored that we had a patient that passed away that had COVID. Anything like that has to be reported to the health department. Please don't spread rumors like that or talk about things like that you don't know. We have tested many patients, many employees, and they've all come back negative. But all of that is very reportable, so don't report it. Don't say it if you don't know it.
Will you tell us if you do?
Absolutely, most definitely. Yeah. And, yeah, no, you're gonna have to know.
And we lost a staff member.
You got what?
Yeah, we lost a new staff member because some other staff told her that the patient was positive and they weren't. So, yeah.
And that we had other patients that we were clustering together because they all had pneumonia, and that was pretty suspicious. And that was from a licensed nurse, according to this person, she did not name the staff member. So that's just her side, so we're just throwing it out there. Be careful.
Also remember, if you do have a license and you stop showing up, this is a state of emergency. All healthcare workers that don't show up or that call in, I have to know your symptoms so I can let the health department know. Some of you, if you have symptoms that are COVID-like symptoms, then I have to get you tested before you can come back. That's just requirement, okay?
Are you gonna do any of the testing just for giggles?
Yeah, actually, EMS is supposed to. When they get the rapid test, I was quite surprised a couple of days ago when I found out the rapid test, the governor said, Monday morning we're coming to us And then Tuesday, I find out the hospitals have them. So,
Is that the one that goes in the nose?
they swab the nose, yes, and they get a 45-minute test back and results back in 45 minutes. So they were supposed to randomly test all the nursing home employees. What they ultimately want to do when they get enough tests is test 10% of the nursing home employees. So we'll do that. Actually, we've tested probably 10 so far, and I've gotten negatives. Yeah. All right, questions, anything?
Found out anything about the hazard? The
Hazard pay.
Oh, not yet. I hear they have to approve more money because they hit the cap pretty quick. So I hear that they're pressuring Trump to approve more money. I think he will. I think he will. What's that?
I said, Carrie, call them up.
Carrie, call them, that's right. Carrie has a direct line. Where is she? There she is.
He's the biggest fan right here.
That's your baby.
Other questions? All right, you guys are doing awesomely well. I really appreciate it. Yes, ma'am.
You're clearing out 100, so are we expecting to get a whole bunch of new residents?
So the reason we're clearing out 100 is because our census has dropped, and we found it would be a good time to renovate rooms too. So we're going to do painting and deep cleaning and dusting and fixing baseboards and fixing cubicle curtains and whatever else we need to fix in those rooms, and we're going to rotate the openings around the building. Okay? Thank you guys, I appreciate it.